Have you ever wondered what the color of your pee means and what message it may be sending to you? Is it even important to pay attention to pee color? Well, today we are diving deep into the fascinating world of urine colors and what they reveal about your health. We're going to talk about all the different colors of urine, and we'll even look at some that are really weird like purple or red. Let's start with the basics. What is urine? Urine is mostly made up of excess water from the blood together with a lot of waste products that accumulate in the body and end up in blood. This makes urine an effective way of ensuring that the body stays clean, but it also means urine can tell us a lot about what's going on in the body. And one way we can check what message urine is trying to communicate is just by looking at its color, since each color has its own meaning. Now that we know what urine is and how it's made, we can start looking at the different urine colors. The first one is transparent or clear urine. This one usually indicates overhydration. It's a sign that you're drinking excessive amounts of water, which can dilute urine. Next up, we have pale yellow. Pale yellow to straw-colored urine is something we're all familiar with, and it's usually a sign that you are well hydrated. Good job. Keep sipping that water. But what if it's dark yellow or amber? This often means you are a bit dehydrated. It's time to grab that water bottle and drink up. Sometimes it can come as a result of high intake of water-soluble vitamins such as those in the B family. Now let's talk about red or pink urine. This one can be alarming, but it doesn't always mean something serious. It can be caused by foods like beets, blackberries, rhubarb, or medications such as rifampin, which is a drug used to treat TB, and phenolphthalein, which is used in some laxatives. So if you have eaten beets, blueberries, or rhubarb recently, or you have taken any of those medications I just mentioned, you have nothing to worry about. But if you haven't, it might be blood in urine, a condition known as hematuria, which can be a sign of kidney stones, infections, or even more serious conditions like prostate issues or tumors of the bladder or kidneys. So you definitely have to get checked by a doctor. What about orange urine? Orange urine could be due to dehydration or foods that contain a compound known as beta-carotene, such as carrots. But certain medications can also cause this, such as rifampin, which, as I've already mentioned, is used to treat TB, or another drug called phenazopyridine, which is used to soothe urinary tract discomfort. However, orange urine can also indicate an issue with the liver or bile duct, so it's important to keep an eye on it. Now let's make things more interesting and talk about blue or green urine. Though this one sounds bizarre, it can still happen. Blue or green urine is usually caused by foods with strong artificial coloring. Sometimes medications like methylene blue, which is used in some diagnostic tests and treatments, and propofol, which is used as an anesthetic, can also cause a change such as this. There's also a rare genetic condition called familial benign hypercalcemia, which is also known as blue diaper syndrome, that can cause this strange color change. Now let's talk about brown urine. Brown urine can be caused by foods like fava beans, rhubarb, and aloe. It can also be due to medications such as chloroquine and primaquine, both of which are used for treatment of malaria. Medical conditions that can cause brown urine include severe dehydration and liver problems such as hepatitis, especially if they are accompanied by other symptoms like yellow skin. Another condition that can cause brown urine is rhabdomyolysis. Rhabdomyolysis is a serious syndrome caused by direct or indirect muscle injury, such as in trauma and crash injuries, or intense physical activity such as during a marathon, that results in the breakdown of muscle fibers and release of their contents into the bloodstream. This can lead to severe complications including kidney failure. That said, brown urine that doesn't go away after an improvement in water intake and in the absence of drugs that cause brown urine is a good reason to go to the hospital. Next up, let's look at purple urine. Purple urine is rare, but it can happen, especially in catheterized patients, and it's due to a condition called Purple Urine Bag Syndrome. which occurs when certain bacteria produce pigments that turn urine in the urinary catheter into a purple color. This striking color change is usually harmless but indicates that there might be an underlying urinary tract infection. What about cloudy urine? Well, this one might indicate the presence of pus, bacteria, or high levels of certain minerals. It might also indicate a condition known as chyluria, which is when lymphatic fluid drains into urine. It might also indicate that you have high phosphate levels. And lastly, black urine. Black urine is a very rare condition. When it happens, it could be due to high doses of iron supplements or certain medical conditions or medications. Certain genetic conditions like alkaptonuria, a condition where the body cannot process certain amino acids, or medications like methyldopa, which is used to treat high blood pressure, can be responsible for this color change. Another condition that can cause black urine is black water fever, which is a rare complication of malaria. Remember that while these color changes can give us clues about our health, they are not the final word. It's important to always consult with a healthcare professional if you notice any unusual changes. If you enjoyed this video, you'll definitely enjoy this next one.